So, two things. We were talking about sprains in the ankle, and over time, I guess, you can stretch out those ligaments and have a lot of instability.
Absolutely. So, Carolyn really developed, again, what we talked about, that post-traumatic arthritis. So many years of breaking and spraining the ligaments, you're damaging the cartilage cap that is over top of all of these bones. And the cartilage is literally a living cells. So multiple sprains and fractures, those cells end up dying, and you lose that space between the two bones.
And when she would do that, she was talking about little fractures, and so they weren't like these big blatant fractures where you see a big piece of bone. These were probably just little avulsions or little pieces of bone that are being flicked off of the
chip.
Yeah, just little chips, and they hurt, but they heal.
Very painful, yeah.
They heal. You get better, and then you get confident, and then you put on a pair of heels, and you hit an uneven surface, and boom, there it happens again.
Actually, when I was working, I was administrative assistant, and I gave parties. And a lot of those parties took place on a Friday. And it was good because on Fridays, I couldn't walk again until Monday. So it was a problem.
Thank God for the work week and the weekend. Most people think about going out on the weekends. You just thought about putting your feet up.
Get my feet ready for Monday.
That's right, jeez. So she had a procedure, which is a very dramatic procedure, and I should say that Dr. Buchanan, of course, is one of the few doctors around the country who is certified and qualified to use what are now the 4 major ankle implants. So the ankle replacement surgery is a big-time piece of work, and it's not one that really has had a lot of, let's say, a lot of history relative to hips and then even knees. But tell us a little bit about what we do and what the whole process is like when you do an ankle replacement.
So just like hip arthritis, knee arthritis, when the ankle is so degenerated that we've completely lost the space between these two bones like Carolyn had, we can offer a surgery like a hip replacement, knee replacement that's essentially an ankle replacement. So this is actually a bone model of an ankle replacement. As you might expect, this is simply replacing the arthritic joints with plastic and metal. So this is a technology that has been around as long as knee replacements and hip replacements. Its track record just isn't quite as good. So in 2010, we're fortunate to have 4 choices, 4 FDA-approved ankle implants to choose from. But again, this is it's a dramatic surgery that restores the normal joint mechanics with essentially plastic and metal.
And people, I guess, would think, well, it's a pretty artistic free hand that you use when you put these things in. I think that probably the most significant part is making sure that it's anatomically equal to and gives you the kind of balance that you need to be able to use it going forward.
Yeah, these implants have been around since the 80s, and originally in the 80s it literally was a freehand cut that we were just doing, just eyeballing and then making the cut, where now we have these elaborate frames that we put on the leg to make sure that every one of these cuts is extremely precise.
So it is measured, it gives you some parameters to work from, and gives you some reassurance exactly with the imaging that you have now and the measurements you can take and make, much like brain surgery where they literally do it from another room with the Da Vinci now. It's pretty remarkable that you can do that. I do have one more question for you. So did you have problems feeling balance in your feet? Do you have any problem with blood sugar yourself?
Today, you mean?
Yes.
Now?
Yeah.
Oh, I am fine today. Okay. I'm just sorry I didn't have it done earlier. Yeah. Oh, yeah, it was a miracle. Right. As a matter of fact, no pain at all. No pain. I was in no pain. As a matter of fact, the surgery was on the 18th of April, and the 19th of June, we were on the cruise ship.
All right. So
it was just wonderful.
Sounds like it's a little easier to deal with than even.
I had the boot, and I had the wheelchair with me, but I was able to get around with the boot, and
great, fantastic.
It was perfect.
Good. Well, one of the things we were talking about, which I really wanted to make sure we spend a few minutes on, is the fact that people lose sensation in their feet when they have diabetes. And it's a very significant podiatric issue. Tell us a little bit about what happens there with with your feet and with your extremities when you have diabetes? I mean, there's something like, what, 25 million people in this country with diabetes? Probably 80% know, but even 20% don't, and they suffer through some of those things. Tell us a little bit about it.
Yes, it's called loss of protective sensation. And basically, protective sensation tells you when you have a crease in your sock or a blister or you step on something. Diabetics lose that protective sensation. They lose it because as the blood sugar elevates in the body, it actually starts to crystallize out like little sugar crystals around the nerves. Those little sugar crystals don't have smooth edges, they're sharp edges, and they damage the lining to the nerve. The nerve is still intact, but the lining is damaged, and so you get an unclear picture going down the nerve, which goes to the brain. The brain can't decipher what the body is telling it and will put out weird sensations. So diabetics have pins, needles, hotness, coldness, pain when nothing's happening, vice grip, just sensations that have nothing to do with what they're doing in their life. And eventually they will go numb so that they lose all of their sensation. Well, they don't have anything to tell them that they have a blister on their foot, or they have a sore on their foot, or their shoe is not fitting properly, their sock is rolled up. And so, as she was saying, someone was talking about when you live by yourself, if you're not in the habit of checking your foot, you just ignore it or you don't feel it, so you don't look at it. And sooner or later, a friend will come by or a family member and say, oh, did you know your toe was dark? Or you'll pull off your sock and there'll be a pool of blood in your sock, and then you'll look at the bottom of the foot. And ideally, we're trying to get diabetics before they get to that point.
So that's even people with type 2 diabetes that start to see those changes. So that the blood vessel and the actual immunity, because of their basic support of that tissue down in the feet, and their
Yes.
loss of sensation, they get the injuries, they don't really know about it, they get infections, they continue to traumatize them because
Yes.
it doesn't really hurt. And so you recommend people, when they start with diabetes, that they should get some education, and they should probably establish a relationship with a podiatrist like you.
Exactly. With the nutritionist, you want to get in to see somebody who is going to check your foot. The American Diabetic Association recommends that if you are a well-controlled diabetic, that means your blood sugars are perfect, your doctor is happy with where they are, you still need to see someone at least twice a year. That's every 6 months. If you have out-of-control blood sugars, your blood sugar is not being controlled well, you're having problems, you're starting to see signs, then you need to come in even more often than that. Then couple diabetes with poor circulation, things like atherosclerosis, PVD, then you may even need to come in more because now you're getting actually skin changes, so you don't even have the normal body protection that you would have.
And I imagine also, if you can't feel very much, that cutting your nails is a little bit dangerous too.
It is very dangerous, especially, you know, with diabetes, you know, your eyesight is affected.
Right.
So you may not be able to see clearly. Your foot is further away. You can't get your foot in the right place, or you can't get your hand in the right place. You may not even have the right instruments. Unfortunately, we hear people using pocket knives and all kinds of tools on their toenails. And so, of course, when we see them, they've cut nails, they've cut skin, and ulcerations.
So, word for the wise, we have to make sure that if you know anybody with diabetes, or you do have diabetes, that you have to make sure you take good care of them.